good afternoon, everyone. I am Dr. Marc Evans Abat. I am the consultant head of the Center for Healthy Aging of the Wellness and Aesthetics Institute of the Medical City. So we are in the time of the COVID-19 pandemic, and it is very important for us to be able to care for our elderly relatives or patients in these very difficult times. We have to pay particular attention to our older patients because they are an especially vulnerable group of patients who may be more susceptible to the effects and complications of COVID-19. So we will discuss a few pointers on the physiology of the older patient, and we'll discuss how it relates to COVID-19 and how we manage this set of patients. So this will be our outline for this afternoon. So we'll discuss some concepts on aging. Then we'll discuss COVID-19 issues in the older patient. And then how do we take care of the older patient in the time of COVID-19? Okay, so just to discuss some concepts on aging. Okay, aging is said to be the accumulation of changes responsible for the sequential alterations that accompany advancing age and the associated progressive increases in the chance of disease and death. So basically speaking, there are changes that happen in the older patient that predisposes one to more diseases and higher chances of dying and being hospitalized or having more diseases. So that's how aging is simply defined. Okay, so what happens is there are changes in the biochemical level of the older patient, which then translates to changes in the physiologic capacity of the older person, which then leads to a decline in the homeostasis or the ability to maintain balance in the older patient. This further decline in homeostasis predisposes an older patient to more diseases. And then eventually, because of more diseases, it increases the chances of dying with increasing age. Okay, so in this graphic, we do see that there is a certain discordance with what your chronologic age is, or how old you are actually, and what you are able to do in real time. So you can see some people who seem to be quite old chronologically, like in their 70s or 60s or even 80s, but are able to function very well like they are much younger. And you can see, or you probably heard stories of athletes who are already in their 70s or in their 80s, but are able to function very well as if they are only in their 40s or in their 50s. On the other hand, you may have also seen people who are relatively younger, maybe in their 40s, 50s, or early 60s, and yet already suffer from a lot of diseases and are already disabled and suffer from a lot of impairments. So this is the concept of the discordance between chronologic age and biologic age. So it doesn't mean that you are at a certain chronologic age, you will have a certain biologic functionality or capacity. Those can be two discordant things. And it depends on a lot of factors, including genetics, your diet when you were younger, vices, the environment that you live in, and all of the other risk factors that may affect the way your body ages. Okay, so this is an important slide, and it will explain why people age differently. So as you grow older, the amount of physiologic reserve that you are using to maintain homeostasis or maintain body stability decreases. And the slope of this line differs from each and every person depending on how you maintained your health when you were younger. Of course, an adverse outcome or an event like, or any stress like, for example, disease, an accident, or even environmental stressors can affect the body such the way that it can overcome the amount of remaining physiologic reserve that you have, leading to an adverse outcome like hospitalization, disease, or even death. Okay, so this amount of physiologic reserve differs from each and every one. It again depends on how well you took care of your health when you're younger and how well you maintain your health even at the present point in time. Okay, so as you can see from this graph, certain patients with low vulnerabilities, meaning they are very healthy, they do not have a lot of diseases, they eat healthy, they are functionally strong, they need very high amounts of noxious stimuli to get sick or to get destabilized. On the other hand, people who have many vulnerabilities at the start, meaning they have a lot of comorbid diseases, they have a lot of other risk factors, they are weak, they have a lot of vices, they only need a very small amount of noxious insult to cause instability and adverse outcomes. So this is what basically this graphic is saying. Okay, now we go to the concept of frailty. Frailty refers to the loss of physiologic reserve in a person susceptible to disability even from minor stresses. And it is an inherent vulnerability to challenge from the environment. And again, I will repeat, it is not really dependent on chronologic age itself, but it may be affected by a lot of factors, risk factors, and of course, it is affected by your functional ability. So those who are healthy are able to function very well, even if they are older or have good nutritional status, even if they are older, may not be frail. On the other hand, even if you're relatively a younger, older person, if you have a lot of diseases that are uncontrolled, if you have a lot of vices, you are disabled, then you may be considered frail even at a relatively younger age. Okay, to explain further, the ideal life trajectory of a person is this white line. You want to have a good functional capacity for the longest possible time until you reach a very ripe old age wherein all of your medical problems suddenly appear, and then you end up with a very short time period wherein you are disabled and eventually leading to death. Okay, that is the ideal health trajectory. The usual health trajectory for most people is this other line. So as you age, your physiological capacity gradually decreases until such time it becomes significant until the point of death. However, what can happen is a certain stressor or illness can happen somewhere along your health trajectory, which brings you to a lower physiologic capacity. An example of this is being hospitalized or having an accident. After this event, what can happen to you is either you make a full recovery back to your original usual health trajectory. That is, if you took your medications, you were given proper management in the hospital, you were given rehabilitation, you were given good nutrition, you may be able to go back to your usual health trajectory. However, in most cases, management becomes suboptimal such that as you recover from the illness, you don't fully go back to your original health trajectory. You settle at a lower health trajectory, which means you have a lower physiologic capacity, lower functionality, and less optimal recovery until the time of death. Okay, so now how do we care for the older patient with COVID? So we will discuss certain aspects of COVID-19 in the older age group. As you can see, these are the usual signs and symptoms of COVID in our older patients. Okay, the length of disease is about 7 to 25 days, and the usual symptoms include cough, shortness of breath. Rarely do you have sneezing or nasal symptoms. Sometimes you have sore throat. Commonly you have fever, and you have other traditional signs and symptoms like weakness, headaches, and down the line. A lot of people actually complain of difficulty or inability to smell and taste, and having gastrointestinal symptoms like nausea and diarrhea. That is the common symptom for a lot of people. For older patients, this may be accompanied by lethargy and confusion. You may see your patients becoming confused, unable to recognize people they are usually with, unable to recognize places they are currently in. Okay? They may manifest with increased sleeping time. They may just want to sleep most of the day and avoid eating or avoid going out of the room. And some may suddenly suffer from falls. Some may be very healthy before and are very ambulatory, suddenly manifesting with frequent falling. Okay, older adults are at a higher risk of death. That's why we want to prevent them from having COVID, because older adults are at a higher risk for death. and other complications. Like, for example, in the US, those who are 85 years old have a risk for hospitalization when they get COVID by about 31 to 70%. Admission to the ICU can be as high as 29%. Death from COVID can be as high as 27% in the US. Okay. Here in the Philippines, based on the data from January 30 to April 30, as you can see, case fatality rate, meaning among those who contracted COVID, what is your percentage of possibly dying? For those young at the age of 40 to 49, as you can see, the case fatality rate is about 1.38%. So it's about 1 to 2 persons in 100. When you get to the age 80 to 90, it can go as high as 15 to 16%. Okay, so we really don't want our older patients contracting COVID because there's a high rate of dying if you get COVID in the older age group. Okay, so how do we take care of our patients in this time of the COVID-19 pandemic? Of course, first recommendation is hand washing as frequently, as often as possible. So we know the dictum, 20 seconds of washing the hands using several positions or several maneuvers to ensure good cleaning of the hands. And you have to do it as often as possible, especially if you are handling a lot of objects or if you went out of the house, okay? Wearing gloves is not really recommended because you have a chance of actually having a false sense of security and holding a lot of contaminated objects, even if you are wearing gloves and then putting that contaminated material to your face, to your mouth, etc. And avoiding hand washing because you are already wearing gloves. So it's actually better not to wear gloves and hand wash very frequently. Okay, again, during this pandemic, the recommendation is most seniors should actually stay home. Okay, it is probably the safest place in the whole country, in your own locality to be free from COVID. Your home is probably the safest place. Okay, but we do recognize that can be difficult for some people, especially for active seniors who are living alone or by themselves only, and they really have to get out of the house. So as much as possible, stay at home. And if it is not possible, then you have to be able to protect yourself when you go out of the house. So ensure wearing your face mask, ideally, you should also wear a face shield so that most contaminated particles will not reach your face immediately, and wear your goggles. And of course, when you are outside, sanitize with alcohol as much as possible, or better yet, you have the opportunity, wash your hands frequently. Okay. Physical distancing is again very important. Okay, it drastically reduces the possibility of any contaminated material reaching your body, reaching your face when you're outside of the house. Okay, so physical distancing is very important, and people should not take offense when older patients insist that people should stay away from them. Okay. Again, this is very important. Relatives should be aware of their own health status and of their own possibility of transmitting COVID-19 to their relatives. You have been hearing stories of COVID-19 spreading in a lot of communities in the Philippines right now. Okay? And if you interview these people, they really don't know how they contracted COVID. Okay, they would just say they went to the market, they went somewhere else, or did something outside of their house, and they don't know exactly what it is. So relatives should be aware, especially younger relatives, wherein there's a chance that you might be either a pre-symptomatic or worse, an asymptomatic infected person. So relatives should always be aware that when you come in contact with an older person, you might be bringing disease to that older person. So as much as possible, if it's really not necessary or for the sake of your older patients, try to limit your physical contact with your older patients. Okay, socialize using technology. We have a lot of means of communication with people right now. There is social media, there are other platforms or applications that we can use to communicate with older people. So let us utilize these technologies to maintain social contact with our older persons. And let's maximize this modality so that we can continue socialization with our older persons. Okay, vaccination is very important. Currently, vaccines against COVID-19 are being developed. They are still in development and they are not yet available. Okay, what we have are vaccines for the other preventable infectious diseases like influenza and pneumococcal vaccination and diphtheria, okay, and other vaccine preventable diseases. Okay, why is it important for our older patients to have vaccination? Number one, it reduces the number of diseases. It does not totally eliminate, but it reduces the number of diseases that we will have to deal with during this COVID pandemic. So if you get flu vaccination, you may reduce the incidence of flu by 40%. When you get pneumococcal vaccination, you may be able to reduce pneumococcal pneumonia by up to 60%. That some people may think it's not much, but trust me, it is a significant amount and significant impact on the amount of diseases you will have to manage in your older patient. And there are some reports saying that when you use these vaccines on an older patient and that older patient contracts COVID, it reduces the complications that may happen in that older patient because you reduce the number of superimposed infections that may happen on top of COVID. So let's all vaccinate our older patients. Okay, be wary of shams and quackery. Okay, there are a lot of things going around in the internet being sold or being offered or being recommended as a possible cure, as a possible means of reducing COVID infections. Please be wary of using or taking these things. You may hear people recommending you take this drug to prevent acquiring COVID-19. There is no drug at this point that will prevent COVID-19. Okay, there is no drug at this point that can absolutely cure COVID-19. Okay, all of the drugs that are being used for very severe patients inside the hospital, still with uncertain efficacy. Okay, so please be wary of quackery. Be wary also of all of the other gadgets that are being sold out there, supposedly to protect you from getting infections. A lot of these gadgets are ineffective in protecting you from getting any viral infection, especially COVID. Okay, we want all of our older patients to have a comprehensive geriatric examination. And what is this? We want to look into all of the medical problems that you may have and those that you may not know that may cause you problems later in life or during your life, which may also complicate you if ever you get COVID. So we want to know comprehensively what your health status is. And what does a comprehensive geriatric examination entail? It includes a detailed history, physical and neurologic exam, cognitive evaluation, behavioral and emotional evaluation, functional evaluation. We even try to evaluate your environment and your social circle, and of course, nutritional evaluation. All of these factors are evaluated because all of these contribute to your overall health. Okay, we have to be able to optimally control all of your comorbid conditions. So if you have diabetes has to be controlled optimally. If you have heart disease, hypertension, or any other diseases, all of these have to be controlled optimally so that you don't get any problems that might necessitate you to be brought to the hospital. And again, increase your risk of contracting COVID-19, or that may necessitate unnecessary trips outside of the house, thereby exposing you to people who may have COVID-19. This also includes stacking up on your maintenance medications. So you should be able to buy your maintenance medications in bulk so that you don't need to go out of the house too frequently. Okay, you have to consider also other forms of access to medical care, like a doctor's house call. If you fear going to the hospital or going to a medical clinic or going out of your house to seek medical care, there are ways to get medical care at home, and that includes calling a doctor who can do house calls also. Okay, having regular laboratory examinations is important because it reveals to your doctor all of the things that cannot be seen during the comprehensive geriatric examination. So having regular lab exams is ideal. So the question is, how do we do it during this time of the COVID-19 pandemic? Okay, the hospital, for example, TMC offers a laboratory on wheels wherein laboratory staff and extraction equipment will be brought to your house to be able to extract your blood, extract specimens, and then these specimens are the ones brought to the hospital. Okay, nutritional management is very important because a malnourished patient will surely have very weak immunity and very limited physiologic reserve to recover. So nutritional management entails caloric intake regulation, either increasing your calorie intake or reducing unnecessary caloric intake. Supplementation with vitamins and other micronutrients is important. That can be orally, or for those with deficiencies or other problems that are related to vitamin and micronutrient deficiency, that can be given intravenously. And other nutraceutical supplements like oral nutrition preparations. Okay, exercise therapy is very important. Okay, it's the best way to drive into your muscle all of the nutrients that you are taking in. So it's very important to do strength exercises to maintain muscle mass, conditioning exercises to maintain the integrity of your muscles, and flexibility exercises to maintain joint flexibility. Okay, mental health and stress management is very important. Imagine you're an older patient and you are being forced by your younger children to stay at home. Of course, you have to maintain a sense of normalcy even if you are stuck at home or confined at home. So what does this involve? Again, we utilize technology to socialize with other relatives or friends. You continue your hobbies that can be done at home, like for example, if you do crochet, painting, play music, etc. You continue it at home. You do exercise as a form of mental health management. Okay, so maintaining physical health is important, but it's also important for you to maintain your mental stability and health. Okay, so that's the last slide. I do hope that you are able to get something out of my talk, and I do hope you are able to be more aware of how to protect yourselves as older patients and younger relatives in protecting your older relatives from getting COVID-19. And with that, thank you for listening.